Good day, Professor Emeritus, professors, doctors, masters, and everyone seated here today. My name is Dr. Voke, and I'll be making a presentation today on the factors influencing clients' decision-making process in private healthcare institutions in Nigeria. And this is a paper presented by myself, Professor Emeritus N.E. Mazibuk, and Professor J. Kruger. The overview. In this presentation, I'll be taking you through the introduction to the literature review. I'm going to present the hypothesized model, the hypothesis, the research methodology, key findings, managerial implications, and recommendation, as well as the conclusion. The impact of the healthcare sector and economic vitality plays a major role in the upliftment of the society. In other words, our country's stability and sustainability will depend on how healthy its population is. This is true. As an example is the presence of COVID-19 and its negative effect on employees, businesses, society, and the economy. Therefore, the reduction in mortality rates and increase in healthy workforce that performs work duties are likely to promote economic activities, which will in turn increase the country's wealth. This brings us to our topic of discuss today, the client's decision-making process. The client's decision-making process refers to the process undertaken by clients in order to make choices on healthcare institutions to satisfy their need for wellness. Client decisions regarding healthcare services are often based on the cost, the intensity of the sickness, and the importance a client's need to look after its health. Therefore, the client decision-making process provides clients the opportunity to choose from healthcare institutions that offer quality healthcare services, and the process allows clients to make decisions about health-related treatment. Research objectives, problems, and objectives. The government in Nigeria at various levels is a major provider of accessible and affordable healthcare services based on primary healthcare to all Nigerians. To improve the well-being of all citizens, the Nigerian government have created beneficial reforms in the public healthcare systems. Despite the reformation in the public healthcare system, majority of clients are more inclined to purchase healthcare services from the private healthcare institutions. This implies that the purchasing decision of clients have shifted from public healthcare institutions to private healthcare institutions. The shift in client decision-making from public to private healthcare institution is as a result of the incessant problems in the public healthcare sector. And these problems include strikes in public health sector, low-quality services provided, long waiting hours, poor facilities and equipment, and lack of medical supplies in public healthcare institutions. The research objectives. This study investigates and answers the following questions. What factors influences clients' decision-making regarding the utilization of private healthcare institutions? And the primary objective is to investigate factors that influence the client's decision-making process regarding utilization of private healthcare institution. The secondary objectives are to conduct literature on decision-making process and its influential factors, and also to provide recommendations on improved decision-making process for better health outcomes. The literature review. Numerous healthcare institutions are recognizing that a client's decision-making process is important and vital for making sales and profit. Many organizations have researched and come to the realization that socioeconomic characteristics such as ethnicity, gender, age, and income will influence the purchase of healthcare services from a private healthcare institutions. Armstrong and Cutler affirms that a client's lifestyle, taste, values, preference, and expectation will determine its purchase decision. More so, environmental factors, nature, and structure of the healthcare system, financial wealth, level of insurance coverage, and communication factors will influence clients' purchase decision. In this study, we presented that factors such as demographics, social structure, health beliefs, personal income, health insurance, and family financial support may influence clients' decision-making regarding utilization of private health institutions. To clarify, we refer to demographics as segmenting a market or population according to age, family size, race, gender, income, education, and ethnicity. Past research shows that a client's age, gender, and marital status will influence its purchase decision, and clients advanced in years usually account for the largest share of a nation's healthcare service cost as compared to a population with younger clients. We viewed social structure as a pattern interrelationships among a set of individual and organizational statuses. As defined by the nature of their interacting roles, social structure comprises of attributes such as education, occupation, family size, and religion. According to past research, clients who are more educated are more inclined to make purchase decisions and utilize healthcare services in the private healthcare institutions. Furthermore, the occupation of a client will determine the level of income earned, which will further influence the client's access and utilization of healthcare services from private healthcare institutions. We also looked at health beliefs, personal income, health insurance, and family financial support. The hypothesized model of the factors influencing client's decision-making process. This figure shows the hypothesized model of the factors influencing clients' decision-making process regarding the use of private healthcare institutions. And the figure reviews hypothesis 1 to 6, which states that there's a relationship between demographics and clients' decision-making process regarding private healthcare institutions. There's a relationship between social structure, health beliefs, personal income, health insurance, and family financial support, and client's decision-making process regarding private healthcare institutions. The research methodology. We adopted a positivistic paradigm using the quantitative research methodology. Secondary and primary data were collected. A closed-ended questionnaire containing items on a 5-point Likert scale was self-developed and adapted from previous study. A total of 500 questionnaires were distributed and 450 questionnaires were returned. This amounted to an effective response rate of 90%. The population of this study consists of all clients utilizing private healthcare institutions in Lagos State, Nigeria. The non-probability sampling technique by means of convenience and snowball was used to determine the sample, and the sample size for the study was 450. The questionnaire comprised of 3 sections, namely the cover letter, Section A, and Section B. Section A of the questionnaire consisted of 85 items of variables on a 5-point Likert scale. Section B contained the biographical information of respondents. The data collected was coded and transferred to an Excel spreadsheet, which was further analyzed by means of statistical computer program version 12. The validity of the measuring instrument was established through exploratory factor analysis. The reliability testing was done by means of Campbell's alpha coefficient calculations, and regression analysis was done to measure the relationship between the independent and dependent variables. Key findings of demographical profile. For gender, 54% were male and 46% were female. 91% of respondents were between the age 29 and 49. 96% of respondents had either secondary school certificate, diploma, undergraduate, and postgraduate degrees, while 4% didn't specify. Key findings of the exploratory factor analysis. This study utilized EFA to describe the variability of correlated variables by means of factors. This table shows factor loadings of the variables of the study, and factor loadings of 0.4 and greater were regarded as evidence of validity. The reliability. This table summarizes the empirical factor structure as a result of EFA. The empirical factor structure consists of each latent variables and items are loaded together to define each latent variable, and the reliability of the latent variable based on the EFA. A Cranbrook alpha of 0.6 and above was considered as satisfactory and sufficient value in assessing the reliability of the measuring instrument in this research study. This table shows variables that are different from the variables earlier presented. This is because respondents did not view some of the variables as a single construct, but were viewed differently. As a result of the comprehensive EFA, variables such as demographics was viewed as a three-dimensional variable and were named personal characteristics, service encounter experience, and accessibility. Furthermore, variables such as health insurance and family financial supports were renamed as items that were supposed to load and measure other variables loaded together in the same factor, with health insurance and family financial supports. The table shows the satisfactory reliability of 0.6 and above for each variable. The reformulated hypothesis. As a result of the comprehensive exploratory factor analysis, changes occurred between items, and this resulted in the generation and reformulation of new hypotheses. The reformulated hypotheses are as follows. There is a relationship between personal characteristics and client's decision-making process regarding private healthcare institutions. There's a relationship between service encounter experience and client decision-making process regarding private healthcare institution. There's a relationship between accessibility, personal income, between access to health insurance membership, between support sources and client decision-making process regarding private healthcare institutions. Key findings on regression analysis. The regression analysis estimated the relationship between the independent and dependent variables. The table reveals that personal income, service encounter experience, and support sources are positively related to client's decision-making process. The client's decision-making process explains 45% of variability in the model. Personal characteristics, accessibility, and health insurance membership do not exert a significant influence on client decision-making process. The managerial implications and recommendation. From this study, it is viewed that service encounter experiences, personal income, and support sources will influence client decision-making process. Therefore, it is important that private healthcare institutions as well as organizations do the following. Now, with regards to service encounter experience, the service environment, interior and exterior, should be well designed. The facility should be user-friendly and support easy access for all patients. Frontline staffs, nurses, and doctors should be adequate to provide quick services to enable clients gain easy access. Frontline staff and healthcare providers should be friendly, professional, calm, show empathy and respect patients, and they should be willing to smile and articulate when they need to attend to clients' inquiry. With regards to personal income, the private healthcare institution should partner with NGOs that are willing to provide financial institutions to clients that are unable to pay for health care services. Also, the government and community should improve access and utilization by allocating funds to the private healthcare institutions. With regards to support sources, private healthcare institutions should encourage family members to pool financial resources to assist in the payment of healthcare services for routine medications and medical emergencies. Private healthcare institutions should also provide informational support by educating family members about illnesses, diagnosis, and treatment, and they should also provide assistance. Private healthcare institutions should also inform family members to provide assistance to clients by volunteering to be caregivers. Conclusion. This study set out to investigate the influencing factors of the client decision-making process regarding utilization of private healthcare institutions. The empirical result of this study indicates that service encounter experiences, personal income, and support sources have a significant positive relationships with the client's decision-making process regarding the utilization of private healthcare institutions. The influential factors that have been identified through the empirical results will enlighten researchers and the private healthcare institutions on issues that influences the client decisions to utilize private health care institutions. Marketers, health systems, private and public care institutions should understand the decision-making process and what influences clients to make to make purchase decision. This understanding will enable the private healthcare institutions to understand what clients value and need, and therefore how well to satisfy the clients and therefore reduce cognitive dissonance. Easy access and utilization of the private healthcare institution, as well as satisfaction in quality healthcare delivery, will create better health outcomes for the workforce and citizens of a country, and this will therefore improve economic development. Thank you very much. Please forward your questions, and we will try our best to provide answers via email. Thank you very much.